Hi there, it's Katie Crysdale here from Lakeview Aquatic Consultants. Welcome back to your weekly Aquatic Industry Insider. So this week I'm here with a colleague who also works in the swimming pool industry, and I wanted to have a chat with her about this topic that has been growing in importance in my work, and I wanted to see if she's starting to see the same thing in her work. It's a different part of the industry. And essentially that is the conversation around bacteria in swimming pools, hot tubs, spas, and how water is not completely sterile. So a welcome to Amanda Tomlinson.
We own Allstarr Aquatics, where I specialize in teaching adults of varying levels how to swim.
So one of the things that I've been seeing a lot of in the certified pool operator course is people coming to class with this misunderstanding that somehow the water is sterile, that they bring their kids to swimming lessons, they bring their kids to public swim, and if they've got a scrape on the leg or they've got flu symptoms or even something more substantial like head lice or COVID or hand, foot, and mouth disease, the average layperson somehow thinks that this is going to be disinfected or inactivated by the pool, and they're going to scoop up their kid, take them home, and all of those problems have gone away. And we were having lunch recently, and you shared with me a story that I was sort of the perfect encapsulation of how the water is not sterile.
My old neighbor's, he had a dermatology thing done for his elbow, had to go and get something removed, and it ended up requiring a number of stitches. So the doctor did tell him to stay out of the water and keep it dry. And he decided to go in a hot tub anyway, because that was available to him on the weekend. And he ended up having to go back to the doctor, and he's been taking IV antibiotics because the infection is so rampant in the fresh wound, just general hotness. And he had to call his doctor because it was showing symptoms that they had said, please call if you notice these. And then they called and had him come in, and he actually was told, like, you are not allowed to get it wet for 6 weeks. You need to stay out. You are on IV antibiotics. You have to come and get bandages changed. So something that was very minor became very major in his life. Right. Elbow, but because of the bend in the elbow, it required more stitches so that they could accommodate for the moving of the skin. But either way, it wasn't a huge procedure, but the outcome is now very, very massive.
And for those people who may be wondering, how could this happen? Just a little bit of background that the pool has enough chlorine, like free available chlorine, to disinfect contaminants that enter the pool. But the piece that seems to be missing when I talk to customers, and maybe you can share your experience too, Amanda, is the customer thinks that that chlorine is somehow high enough, it's going to nuke any potential bacteria instantaneously. And it's not an instantaneous process. It takes a couple minutes, anywhere 8, 10, 12 minutes at a low concentration to kill that bacteria. So if you have an open wound, open skin, I mean, that bacteria is going straight into the
call out. One of my clients currently is an ICU nurse. So he chimed in with his medical opinion on exactly what you just said. Like, it gets in and it can create infections and breed all sorts of different issues that can get into your bloodstream, and it can create further exacerbated issues.
I think that's the one thing I would say as a lifeguard. Over the years, I've had customers come up to me and say, is it okay to swim? I had, this hip replacement, this knee replacement, this cesarean section, this scratch. And for me as a lifeguard, it always came back to what was your doctor's medical guidance, because each person is going to be different in terms of if they're high risk, they have other comorbidities like medical conditions. Obviously, without disclosing any medical issues with your neighbor, could you just speak broadly? Do you think it's somebody who was surprised to get an infection from a hot tub, or
I think he didn't even realize that it was an issue. He put some waterproof Band-Aids on it and thought that that would be enough, because the marketing for waterproof Band-Aids is excellent. They have people convinced that you put this Band-Aid on yourself and the water will not get in. And that just simply is not the case.
Well, and I want to hit on those Band-Aids for a moment, because we were talking a few months ago about tattoos, and I don't have any, but I was asking people who have tattoos and work in the aquatic industry what they've heard in terms of post-tattoo care. And it really runs the gamut in terms of quote unquote protecting your tattoo between plastic wrap. And somebody told me there was a plasma layer. Somebody told me just to use a waterproof bandage. What was your experience as somebody who's had tattoos before? And
always told me to stay out of the water. The length of time does vary from artist to artist. Essentially, now I'm finding more artists are saying, until you have no scabs, do not get in the water, because everyone, they're starting to figure out that people heal at different rates of speed. So someone who heals really quickly might have no scabs in a week, whereas someone who takes more time to heal might take 2, 3, even 4 weeks to have it be fully scab free. So I know when I got my first tattoos, it was 2 weeks, stay out of the water, keep it like shower, but keep it as dry as you can. And then I did get this one in Mexico, and the artist did say, like, stay out of the water, but he also realizes that people are on a tropical vacation. So his suggestion was actually a baby butt cream to put all around and over top to seal the water out. And then I kind of just kept it out as best I could for that.
Funny you mentioned about the vacation, because that was one of the things that immediately came to mind to me. My friend is a travel agent, and so she's always staying on top of new resorts and new cruise ships and different things that people might be interested in trying. And Virgin Cruises, one of the novelties on their first cruise ship was to have an in-house tattoo artist. So you can go on a cruise and you can memorialize your cruise with a tattoo. But that was the first thing I thought. You're in the middle of a beach vacation to a warm country, and you're going to get a tattoo. It's a great novelty, but then you're going to restrict yourself from going
to the
hot tub for the rest of your vacation. How does that work, I wonder, in terms of education?
Someone must be missing the mark there, because that seems like a really great way to end up with a lot of negative complaints and comments about the experience as a whole, because now you've got something on your body that is permanent and also permanently ruined, potentially.
We all need to do better in terms of educating people about the risks of these types of activities, in terms of, there's no judgment on the tattoo. It's just the timing. I know you worked in pools and management for a long time. What sort of policies or commentary did you have in place for employees who are considering tattoos?
A lot of the staff would come to me and ask anyway, just because they're like, how long do I have to stay out? What should I do? And my recommendation to them was always try and pick a time when you're not scheduled, so that you're not having to cover your shifts off, and you're not having, especially if they're teaching shifts, like the guarding shifts, they weren't as concerned about, because if they did have to go in for a rescue, chances are they're in, they're out, they can dry off. It's the equivalent of a shower. They'll just shower, wash it off, clean it, move along. But when they were teaching, we always recommended try to do it in the gaps where we didn't have lessons, or in a time where they knew it could they could plan it so that it was over a weekend where their lessons were canceled or things like that, just so that the stress level of trying to keep themselves safe while also keeping their shifts covered, just a logistical piece.
Well, and the way I framed it myself when I teach certified pool operator courses is just my understanding that tattoos are pretty expensive. You're hiring an artist, and so the investment of your tattoo being damaged or the lifespan being shortened by exposure to, like, being soaking in pool water, it's not just the risk of infection, but I also understand it has something to do with how long the tattoo lasts, or the vibrancy of the colors, like that.
After working in the pool, the ink can just fall out, is what they call it, where you have essentially a hole in the middle of the piece because there was a scab that was there and it fell off while it was in the water, and the water got in, because when they are giving you a tattoo, they're injecting ink underneath your skin. So if that skin piece falls off before it's fully healed, then you'll just end up with holes.
Well, and I think, like you said, you're allowed to shower when you get a tattoo, but being submerged in water to teach lessons for 2, 3, 4 hours is completely different. Or even a 1-hour lesson or a 30-minute workout, I don't think is the same as, like you said, waterproof bandage. It's not really waterproof when we talk about the submersion or prolonged
I actually lost my belly button ring to swimming because I was unable to stay out as long as I needed to. And because I'm a slow healer, I tried the waterproof Band-Aid thing and it ended up getting infected, and then my body rejected it, pushed it out.
Well, and I think that's one of the considerations. I know back in the day with my friends, it was getting their hair done, you know, $200, $300, $400 on hair dye was not practical if you were going to be in the water with chlorine 6 to 8 hours a week. And then the new one I've been hearing on decks is, you know, false eyelashes or anything like that, where there's a lot of glue involved. You're paying a premium for high quality lashes that really can't be wet for extended periods of time without being properly dried. So it is one of the challenges. One of the other questions I had for you, last time I saw you, we were talking about other types of bacterial infections that we had either personally experienced in the pool environment or other people we know had experienced. So I know for myself, I got pink eye, conjunctivitis back in 2015 because I was living alone, working as a pool manager, did not interact with children that day, was in my office for most of the day, but had a lifeguard get into a car accident and so got changed to sub out her preschool swim lesson from 4 to 5. And none of the kids, to the best of my recollection, had pink eye, had anything suspicious, but I was working directly with preschoolers, 3 and 4-year-olds in close proximity with floats and glides, water's drifting from their faces to my face for 30 minutes with very little time for it to be disinfected by the legal free available chlorine levels. But it's just the reality that I woke up the next day with double pink eye.
So had pink eye from teaching, but because it was earlier in my teaching and guarding career, I was teaching multiple days a week. I, at one point in my career, had a standing prescription from my doctor for a specific drop for pink eye because I was getting it so frequently. And I also, at one point, had essentially every 6 months, I would get a really, really aggressive bout of bronchitis. And it always timed in when a kid had come to lessons hacking and aggressively sick. And their parents are like, oh, it's just a little cold. So my question to them is, did they go to school today? And if their parents say no, then they shouldn't be at swimming either.
So many parents I've talked to over the years, same as you, where parents think the pool is somehow different from being contagious at daycare, contagious at school. We had one parent bring their kids into my last municipal pool, and the lifeguard, who was a parent herself, came running to my office and said, I'm pretty sure this kid has hand, foot, and mouth disease. And when she went over to speak with the parent said, oh yeah, he's contagious. He can't be at school today. So I thought we'd come to the pool for some family time. And in their mind, thinking the chlorine somehow inactivates any threat or hazard of contagion by being in the pool area. Didn't know what hand, foot, and mouth disease even was, but she said, you know, my sons had it a lot when they were little, so I know intimately what it is. And then when we pulled up the CPO textbook, because I really had to look, it is super contagious through the water. It's easily killed by chlorine, but it's those surfaces like mats, life jackets, towels, high contact points. It's super contagious.
Like, there's so many places that they could touch, pass it off, and now you could have an entire staff that's got hand, foot, and mouth.
With your clients, because you work with a lot of different families, have you noticed any shifts since the pandemic in terms of it being culturally less acceptable to come to the pool sick, or is it about the same as a consequence of it?
I noticed that there was a lot more people staying home when they didn't feel good for a bit after we moved through the big chunk of COVID. But I would say we're getting very close to being back to, I'm sick, but I'm still coming because I've paid for this. And I think that's the mentality a lot of people take, is that school, in most cases, people aren't truly paying for, or they don't see how they're paying for it. So they just think like, we're missing school, it's not a big deal, but this is a service that I've paid for and there are only so many, so I can't miss out, because then that will put my kid behind. But your kid could end up being put back or behind because they're going to miss even more lessons because they get even more sick.
Well, and I think that's such an important recovery piece. Like you said, going to the pool, missing one workout because you don't want to break a streak or you don't want to lose your money is up against the recovery period. And it whether we talk about like a skin infection or a bacterial infection, or one person had shared with me recently that they were getting a lot of UTIs while working in aquatics, and they decided they were just done with aquatics because it was just too difficult to manage. It's not that the water is inherently unsafe, but sometimes it's the behaviors of the people who come to the water. And we, as operators, we only disinfect it to a level where we expect people to be compliant with their health. We're not expecting the burden of higher levels of contamination.
Piece of the social contract where you post all those rules in the expectation that someone is going to actually acknowledge and follow them. But a lot of people just put their own wants and desires over what is going to be best for the facility and the people that utilize it.
And I think people are also missing the piece where it's a public pool. I mean, what we're talking about here, you can do what you want in your own backyard pool, your own backyard hot tub or spa. But like you just said, the signage piece, I can't tell you how many facility operators I talk to who are terrified of kicking someone out who appears to be ill or sick because of the bad reviews, because of the pushback to management, the complaints, even though they have the right in public health codes to say, look, you appear to be contagious, you're coughing, vomiting, diarrhea, your child has pink eye. Nobody seems to want to exercise that standard anymore.
And I would completely agree with you on that, because there's a lot of times where there's just, we look the other way because the person who is on deck that has to deal with it doesn't necessarily feel empowered to deal with it.
We were talking a little bit before we got started too about the location of different, injuries or stitches where people might get sick from being in the pool. I know sometimes it can also be just a consequence of working in aquatics. I had a colleague a long time ago. We were teaching Swim Kids 1, early level. Kids are jumping into the pool very nervously. Larger kids, sort of 6, 7, 8 years old. And she got scratched in the face by a kid who was really, really nervous jumping in. And throughout that week between our Sunday lessons, she used foundation on her face to try and cover up the scratches because she was concerned publicly how those scratches appeared. And she ended up having a WCB claim, Workplace Compensation Board claim, because, my foundation is pretty old, not necessarily very sanitary makeup. And mixing that in bare skin multiple days did result in a skin infection. And I think you said you had experienced something similar with someone you know.
Yeah, we went on vacation and we were in Jamaica, and there was a water slide at the resort we were staying at. And this dude went down the water slide face first and scraped off a good chunk of the skin on his face. And he had a couple of stitches in his chin. But we're in Jamaica. It's hot. It's humid. People are sweaty. He was in the water cooling off. He was in the ocean occasionally. And by the end of the week, his face was just like puffy and swollen. And they actually had to give him doctor's clearance just to even get on the airplane to go back home.
Well, and I don't know if this is something that I've just paid more attention to in the last couple of years, or this is something that's actually on the rise in terms of bacterial infections. But I know this summer my husband had a bacterial infection in his knee and had emergency surgery. And then shortly thereafter, I talked with several, colleagues and friends, and 3 other people in the Calgary area had major bacterial infections that summer, one even resulting in a foot amputation. So I do also wonder too, just the virulence of some of these bacteria up against
chlorine does a good job, but it can't be expected to just be the almighty killer of all bacterias.
I think they also don't understand circulation, right? An older pool with bad circulation, there could be pockets of the pool that don't have sufficient free available chlorine because other areas have better water flow or better levels of chemical, or, the shallow end is where all the kids are playing. So the chlorine disappears there faster than maybe in deeper water where there's higher volume of water to mix and balance out low chlorine with high chlorine. I think it's just the average person. I mean, you see it when you work with clients, right? They may not really understand the risks. They're just focused on the cost. And I do
have a couple of clients that have gotten tattoos in the last 6 months that have actually taken a significant chunk of time off to accommodate for their healing time. So that was a super positive for me, knowing that they're being educated properly on the healing process.
So that's all I have. Do you have anything else you want to add in
No,
or touch
I think
on?
it's great to have conversations that are going to help educate more people about the weird minutia of things in aquatics that people just aren't even necessarily aware of.
Well, and it's just interesting because I always think, like I think back to that woman who brought in her son with hand, foot, and mouth disease. And I didn't have the conversation with her. My lifeguard did. And the lifeguard came back to me afterwards kind of to say, well, she said her pediatrician didn't tell her not to go to the pool. And she was pretty upset about it. And in that situation, I kind of think, well, the pediatrician's not going to list off, don't go to the pool, don't go to the bowling alley, don't go to the library. I assume, not having had children with working with a pediatrician, that their catch-all of don't go to school probably encapsulates a lot of public facility activities. But this woman was really upset at the lifeguard saying, well, he didn't tell us not to go to the pool. So I just wonder where we slot this knowledge in for people to, where they're going to pick it up if we don't
I feel like
give it out like this.
School is not the end all be all for a lot of people anymore. They send their kids to school because it's the thing that they do, and they're more concerned about their extracurriculars, and the extracurriculars are the ones that they're not going to want to miss. But I feel like when a doctor says your child is contagious, a parent should acknowledge that and say, my child is contagious. That means I could get this. That means anyone else in our house could get this. So that means we're not leaving our house because we don't need anyone in the neighborhood to get this.
The only other one that comes to mind for me was a similar one at the same facility where the poor child, we felt so bad for him. He was maybe 9 or 10 years old. He had diarrhea at the end of swim club practice around like 5:15 p.m. and was embarrassed, didn't tell anyone, then went from the main lap pool to the hot tub, didn't tell anyone. Then it was all over the shower. And when we spoke with the parent and the swim club coach, because this was the second diarrhea incident in 3 months, the parent admitted, he said he didn't feel better, but it had been 4 or 5 days. So I thought he was just making up his symptoms, or I thought he didn't want to go to practice, or I thought, so I guess giving a little bit of a parental push, but completely misjudged how ill the child still was in terms of the appropriateness of, okay, he's not coughing and hacking, but any sort of bodily fluids like that are extremely high risk and concerning for us in a pool environment. And heaven help us. I mean, he said he was sick at the end of practice, but we truly don't know. Practice ran from 4 to 5:30.
Well, and as a parent, there's often times where you do have to be like, are you actually sick, or do you just not want to go to something? And sometimes we make the wrong call. Like it happens. After swim team practice, that's the group you don't expect those kind of things from.
Well, and that's where I really tried to have a conversation with the coach, because this was also not a high performance athletic team. Like this was not a high level club, which I had a lot of experience with in my first job back in Toronto. This was very much a recreational club, the main club for the community I was living in. But to have a coach, because my conclusion initially was that the coach was so harsh about missing practice, why else would these parents be sending their kids to practice if it's not going to be a big deal? And we never got anywhere with the coach beyond them thinking that Katie, myself, that I was being a bit dramatic about the impact of diarrhea on the pool. There was a big disagreement for them in terms of they didn't think they were responsible for the costs of all of the lessons we canceled, or the pool rentals, or the cleanup, or the overtime. And to be clear, we never billed them the full amount, but my recreation manager was keen to try and send a message regarding their own complicity in not educating their swimmers and their parents, like that the club should be educating swimmers and parents. And so we had priced out that we estimated there was a $1,500 revenue loss to lose lessons from 5:30 to 7:30 that night. And then we looked at, the rough staffing costs, the rough overtime and chemical costs, and the rough revenue loss for missing lane swim and programs the next day. We didn't charge that to them, but I know my manager was very keen to say, hey, look, if this happens a third time in a short period of time, we are going to be looking at a way to recover some of this, because to your point, Amanda, like you don't expect competitive swimmers to have that happen once in a season. never mind twice in, I think it was like 4 weeks or 5
At
weeks.
an outside maximum, you're expecting the swim clubs to throw up, maybe, but not diarrhea. But at like, and it even brings to the point of what you're saying, that the club and the pool operators, everyone has a responsibility to help with this education, because we're all existing in the same environment. But obviously, it sounds like in this situation, the club was not doing their part.
In that specific case, I remember having to go to the CDC website. So the CDC has their Healthy Swimming website, which has citations to different medical recommendations and scientific papers about the risks of things like diarrhea, because they were very much taking it as, Katie's the new pool supervisor. She's really harsh. She's not pro-community. She doesn't understand. It was very that I was the bad guy. And I actually saw something similar happen just a few days ago. There was an article in the US. It was a community in Massachusetts where somebody dropped a jar of tomato salsa on the pool deck, and the jar shattered into the pool. And so they had to drain and refill the pool. And the community administration staff was doing a great job on Facebook promoting exactly what steps they're doing. So today we're draining the pool, then we're going to vacuum out the glass, we're going to sweep it. Very transparent, very proactive, not blaming, did not name the person with the salsa, anything like that, but just said, hey, we estimate this is a $15,000 closure. And the Facebook comments, oh my gosh, were just so discouraging, because people were saying they were being overly dramatic and completely unnecessary. And I guess for me, this long story is just a tie-in that I don't think people understand any of the operational costs associated with a pool. They're upset that their taxpayer dollars don't have the facility open, but the literal costs they don't comprehend until, because we throw up these numbers, $1,500 for a 13-hour diarrhea closure, $15,000 for a week-long pool drain and scrub, and people are astonished. So there's a big gap.
I think there's also just a lot of lack of knowledge about most things. Like, people don't even understand that just the simple equipment that you need to have on a pool deck in order to open the doors, they don't understand how much that just costs, just to have that in place, even if nobody shows up and swims. So there is a big disconnect in the education, because even the education on water safety is still so lacking, depending on where you're going and what you're getting your information from. So there's lots more work to be done.
I want to say a big thank you to Amanda Tomlinson. Do you want to tell us where people can find you?
At www.allstarr, ALLSTARR, aquatics.com, or they can follow me on Instagram at allstarr.aquatics. The Allstarr still has 2 R's. I did spell it incorrectly on purpose. So they can find me there.
It's memorable. Yep. No, I like it. It's memorable. It's memorable. It's, and I think, when I think of Allstarr spelled the normal way, I think of like a multi-sport camp. So I like that you're doing something a little bit different.
That's where they can find me. And if they're in the Calgary area and are looking for some adult swim lessons, hit me up.